Well, good afternoon. It is great to be with everyone. My name is Christina Holt. My pronouns are she, her. I'm with the Center for Community Health and Development at the University of Kansas. And in that role, I help support the evaluation of the RPE efforts in Kansas. And so glad to be with you.
Hello, everyone. I'm Belinda Flores, she, her pronouns. I'm the RPE director at the Kansas Department of Health and Environment, RPE, Rape Prevention Education, and happy to be here.
So we thought we'd start by just sharing a little bit of context about who we are, where we're coming from. So the center that I work for supports a mission of participatory research and evaluation, teaching and training, and technical support and capacity building, which we do partially through the community toolbox. And we provide supports for public health and social change efforts and for participatory evaluation, both in Kansas and some around the nation and internationally as well.
And with the Kansas Department of Health and Environment, we work to protect and improve the health and environment of all Kansans. With my program, I help administrate those RPE funding and then also the Preventative Health and Health Services Block Grant, sexual offenses portion, and also support efforts for sexual violence prevention throughout Kansas in other ways as I can as well. And before we continue too, I just want to kind of give a little brief rundown of our presentation today, kind of what we're going to be doing. We really hope that you all are engaged in this presentation and willing to interact. We'll have some discussion amongst groups and a share out as well. So hope that you are cooperative with, giving your best and being present today. And we'll have different resources shared. We'll go through 4 of our main community prevention coalitions throughout the state. And I just want to give a shout out that one of our people from those, Gabby Boyle, is here. So might be able to hear some directly from the community coalition leader for that. So with some of the other work to support sexual violence prevention in Kansas is done through our Kansas State Action Committee. So every 5 years we work together, the Kansas Department of Health and Environment and Kansas Coalition Against Sexual and Domestic Violence create the Kansas Comprehensive Plan to Prevent Sexual and Domestic Violence. So this plan is to guide our prevention work in Kansas, and we have different goals for that as well. And partners from across the state join, such as rape crisis centers. We have the Government Grants Office attend those meetings as well. And it differs from agencies that we are funding and agencies that we are not, but are still doing that prevention work. So here are our 5 goals for the Kansas plan. Goal 1, decrease social norms that lead to oppression, and that's including male superiority and sexual entitlement. Goal 2, increase equity for people who experience gender-based oppression. Goal 3, decrease unequal burden of risk factors for sexual and domestic violence. Goal 4, increase efforts at the individual, relationship, community, and societal levels to prevent sexual and domestic violence before it occurs. Goal 5, increase the capacity to monitor, evaluate, and improve primary prevention in a data-driven and evidence-based manner. Goal 6, obtain resources to address prevention of sexual and domestic violence. I know lot of words for those goals. We do have our state action plan on our website, but we'll also kind of address some of these goals through the work that's being done in Kansas and kind of share, what does that stuff mean? Having it written out in a plan is great, but we want to share how we're doing that work as well.
Thank you, Belinda. So I know a lot of us in this room are probably familiar with the socio-ecological model that's shared by the Centers for Disease Control and Prevention, but this is certainly a model that helps guide and inform our efforts, and we try really hard, and we've been, having kind of a shift over the last 5 years to really have an increasing focus at that community and societal level. And so we've been working hard to address things like the socio-economic, educational, social policies that are really maintaining social inequalities that are in our state. So we'll be sharing a bit more about what's happening at the community level. Wanted to share one other model with you that we use to guide our work, and that is this framework for collaborative action. And this was published by the Institute of Medicine, and it's a model for working together for collaborative community change and improvement. And a lot of this will look familiar to you, I'm sure. But the idea is that community is engaged throughout all of the processes of our collaborative efforts, really starting with that assessment to help us understand what the gaps are, where the disparities are, and what the resources are to address the needs in the community, as well as a community engaged prioritizing process and planning for what to do for implementation. And then that leads to targeted action that's based on assessment and grounded in the local context. And those actions are really put together in order to change community systems and can include things like changes to the environment. You might have heard of CPTED, or crime prevention through environmental design. That's one example of an environmental change that can be made in order to make the community a safer place for all residents. But community and systems change, we know, takes change over time. And ultimately, the goal is to affect those risk and protective factors that we know are affecting the issues that are presenting in our community. And then over time, we can begin to affect those population level outcomes that we care about as they relate to sexual and domestic violence. So we do utilize a participatory approach to understanding and utilizing data to inform the efforts. And so we ask different questions of the initiative along the way. And using that participatory approach, we ask things like, are those folks who are most affected by the issues participating in planning of what to do about the issues? Also, are there changes in communities and systems? And what factors might be associated with our ability to bring about change? And how are those changes in communities and systems contributing to changes in those risk and protective factors over time? And then ultimately, in time, we can start to look at trends in those population level outcomes that we care about and whether we are moving the needle. So each of the grantees, as well as at the state level, we're utilizing the community checkbox evaluation system as a systematic way to document that progress towards community and systems change. And that helps with institutional memory and knowledge. It helps with the ability to tell the story of what's happening in the communities. And it helps with quality improvement and using data for reflection, and also being able to share about the effort with different stakeholders.
So this map shows where our 4 community sexual violence prevention coalitions are located throughout the state. You'll see on the right there side of the map, there's 3 of them clustered. Those are all more urban locations. We'll go through them more as well. And then we have our left out all alone out there in rural western Kansas. And that is Finney County that we will begin with. Finney County's efforts are led by Live Well Finney County. Finney County. They are a health coalition and based through the hospital. So as I mentioned, Finney County is rural western Kansas. Their population is 28,157, just to give you an idea. And their population is pretty diverse. They have people coming from over 35 countries speaking about 20 different languages throughout the community. A couple of specific percentages. 50.3% are Hispanic and Latino. Those who are 5 and over, 43.3% spoke a language other than English at home. And 1 in 5 residents were born outside the US. So a lot of, or a background of how Finney County is so diverse, they do have a meatpacking plant, and that does gather a lot of immigrants and refugees to work there. And that population is very important to Finney County as well. So all of our community coalitions did a assessment to see what different areas would be good strategies for their coalition to focus on. And Finney County's are to improve youth well-being, improve neighborhood connectedness, and increase civic engagement. And I just want to highlight the civic engagement part because, as I said, Finney County has a diverse population, a diverse community, and they recognize the importance of that community. So with civic engagement, they are trying to increase voting with marginalized communities, but they're also working to provide leadership training to those communities. Coming up soon, hopefully, they are working with the Kansas Leadership Center to provide a training for leadership for kind of focusing to recruit those marginalized communities to participate in it. And they're using some funding for someone to be able to come and provide that training in Spanish as well, to hopefully make that training accessible to who we're trying to reach, who we're trying to get involved, so that they can get those leadership skills, and then that leadership in their community can represent the rest of it. And it's, those who are making the decisions can be more connected with the community and know what those needs are.
Thanks, Belinda. Another one of the RPE communities in Kansas is Lawrence and Douglas County. And shout out to our colleague Gabby Boyle in the room. Some of you may have had the opportunity earlier today to hear from Gabby about the efforts happening in Douglas County, but if not, they are available here and can help give us some more detail about and questions that you all might have. A little bit of historical kind of background about the work happening in Lawrence and Douglas County. And one thing that I think is interesting is that in each one of the communities, the work looks different. So the lead agencies aren't always, rape crisis centers. Sometimes they're health departments, sometimes they're local coalitions that have existed for a long time. So there's so many different partners that we can work with to really advance this work. And in Lawrence, how it came about was that the Sexual Trauma and Abuse Care Center approached Live Well Douglas County that had been an established coalition for about 10 years, doing a lot of multi-sectoral work to address different food insecurity and opportunities for physical activity and some related social determinants of health, and asked about kind of joining forces so that we could have a more community-wide collaborative response for sexual violence prevention. And so we started a new work group, part of Live Well, and supported with backbone support from the Sexual Trauma and Abuse Care Center from the RPE funds. And that was a really great collaboration. And over the last 5 years, the coalition has made a lot of progress. So initially in 2018, the work group used the approach laid out by the CDC in connecting the dots, and really was looking at, how can we better understand how sexual violence is happening in our community and what the unique risk and protective factors are that are most important in our community, so we can begin to prioritize what to do about that. So we conducted an assessment that engaged community residents through a community survey, as well as looked at existing data that we had available. And then we had a community engaged process where we had different sectors of the community engaged all throughout, informing, what methods do we want to use for our assessment, and what is this information telling us, and what else do we need to find out, and who else needs to know about this. The nice thing is we did already have a community assessment in our community that had been conducted by the health department in collaboration with a lot of different sectors. So we were also able to take advantage of that information that had been gathered and really grow and build on that as it specifically related to risk and protective factors for sexual violence. So what the work group members saw from the data was that there were some primary risk and protective factors in Lawrence and Douglas County that were really most strongly affecting our residents. And those were a persistent gender pay gap and income inequality, poverty and diminished economic opportunities, high rates of residents experiencing severe housing cost burden, high percentages of households experiencing food insecurity, and a high alcohol outlet density. And from there, we engaged in that prioritization process of, okay, here are the things that seem to be affecting our community the most. Where do we feel like we can have the most impact? What issues are affecting the most people? Where is there some readiness? Where do we feel like we can uniquely contribute? Where is there maybe kind of a gap in terms of collaborative action is not happening? And so we also know from the assessment that there were certain groups that were disproportionately experiencing risk for sexual violence. So for example, we know that the Black population, which comprises about 5% of our overall county population, has significantly higher rates of poverty at close to 26%. We also know that our Hispanic and Latinx population experiences high rates of poverty at around 28%. And we know that the 5-year average of households in Douglas County experiencing severe housing cost burden, which is defined as, spending more than half of your income on your rent or your mortgage, that is around 18% in Douglas County, and that's much higher than our overall average in our state. And we know that median incomes are lower for those Black, Indigenous people of color in our community, so we know that there are huge disparities in housing. related to and in our, another part of our community was doing a homelessness assessment and saw a disproportionate burden of homelessness on women in our community. So there were disparities around housing. Of course, those were made worse by the pandemic. And so that issue was something that the community really wanted to address. Related to high alcohol outlet density, the coalition decided to implement bystander intervention training and kind of sub-TED training specific to bar environments within bars and alcohol serving establishments. So our friends at the Sexual Trauma and Abuse Care Center worked with the city of Lawrence and were able to get an ordinance passed that front-end managers in all alcohol serving establishments receive training on bystander intervention techniques. And so that's been implemented over recent years. And then related to affordable housing, the coalition developed a working group on addressing access to safe and affordable housing. And that's been led by Gabby Boyle and has really been a collaboration of a lot of stakeholders in the community. And Gabby also recently did a podcast that is available if you're interested in learning more, or you can catch the recording from this morning too, which was a great session. The work group was able to develop relationships. Actually, a city commissioner joined the work. We developed relationships with the Human Relations Commission, City Commission, and other service providers, especially in the housing area. So groups like Tenants to Homeowners and our local housing authority and the local shelter, our local United Way, local tenants advocacy group, and others. And so we really looked at, what are some different potential strategies that could be explored for implementation. But the group landed on working on passing a local ordinance to prohibit source of income discrimination related to housing. And we looked at examples of other communities that had implemented that policy. So a source of income discrimination is essentially when landlords refuse to rent to prospective tenants who are seeking to pay for their housing costs with things like a housing voucher or disability income or rent relief programs, or because of the source of the wages that they earn. So Gabby and members of the work group and other mobilized community members attended city commission meetings and affordable housing planning group meeting and engaged with a number of stakeholders around holding informational meetings in the community about the proposed ordinance. And I'm very happy to share that the City Commission expanded protections against discrimination in February with passage of an ordinance to prohibit discrimination based on source of income. And that law went into effect on June 1st. The group is continuing to partner with the local tenants advocacy group and looking at how we can build capacity within that group and really support their leadership on efforts in the community. Also, we have a new community health improvement plan that's coming out, and so we're looking at in housing as continues to be an area that our community needs to focus on, and so we'll be looking at ways that we can contribute to that. And also, just very recently, some community partners have started looking at a new effort to, they're examining feasibility. They have an interested developer, and they've started initial meetings looking at converting an old school building into an on-site childcare with tiny homes and basically a connected village that would provide around housing for around 40 households. And so continuing to look at additional strategies for addressing available affordable housing in Douglas County. In Johnson County, Kansas, the work looks really different. So they also engaged in a similar community assessment process. Their work is based out of their health department in Johnson County, and they've formed a sexual violence prevention work group to address those risk and protective factors in Johnson County. And what they found through their community engaged assessment process, and they had a community survey that was completed by over 800 residents. And the group that is involved with those efforts represents a lot of different sectors of their community, including schools, local community colleges, local health systems, corrections, local service providers, and including mental health providers and rape crisis centers, disability serving organizations, the Kansas Department for Children and Families, the Johnson County Department of Health and Environment. So what that group has found is that specifically in Johnson County, where there's a lot more affluence, there's actually a high level of disconnection. And so we know that a key risk factor for sexual violence is lack of social connectedness. And we also know that in Johnson County, the female to male median income ratio is 72 cents on the dollar. And that's especially, there's even more disparity for some racial and ethnic minority groups. So there are disparities in income of approximately $20,000 between different groups in the county. And we also know that in Johnson County, compared to men, women are more likely to be below the poverty level, even if they are employed full-time. And that's a 1.32 female to male ratio. So the group has really taken that information and prioritized their action in order to address those social determinants. And they have been working on, they formed a gender pay equity group, and they've been working on how can we support adoption of programs and policies and practices in Johnson County work sites that will facilitate more gender pay equity. And we have, that group has started to partner with other groups that have similar goals. So there's a child advocacy organization in Kansas that had been working on family-friendly workplace policies. So we've joined forces with them. And wouldn't you know that family-friendly workplace policies is also supportive of gender pay equity and is language that is sometimes a little bit easier for employers to hear. So the group has been working on planning a summit that is actually happening next week, where they are inviting decision makers and human resource representatives and stakeholders in the community to hear about how to adopt family-friendly workplace policies. And then there will be technical assistance available after the summit for implementation of surveys that employers can put out in their workplaces with their employees, who can help prioritize what areas they feel need the most attention in the workplace. And then that information can be used to really help with worker retention and attracting new workers in a competitive workforce. So we know it's good business for employers as well as good for Kansas kids and families. And I mentioned about the neighborhood support and cohesion, where neighbors support and trust one another, and that we know that is a critical protective factor. And so we know that a lot of folks in Johnson County were experiencing low social cohesion. And so the group has decided to work on some initiatives related to social connectedness. So the coalition has recently been working on a literal connection in the community between some community assets to try to promote use of those assets. So there's a local park and a library and a school playground that are all located really close together, but underutilized. So they are working on collaboratively with those entities and other community stakeholders, how can we create interesting community signage? How can we create paths and walkways, things that maybe incorporate art and encourage people to want to utilize these assets and be out and interacting with their neighbors more? Another thing that they are doing is related to promoting social connectedness. They've been looking at like a neighborhood, how to get to know your neighbors and sharing, I'm forgetting the term, but where you share like your skills and it's like a skills bank and you can borrow, what? Kind of like a co-op, yeah. And so they attracted an unlikely partner, which is emergency preparedness. And wouldn't you know that when you know your neighbors, that is a good thing for emergency preparedness. So they're actually working, just as of recently, working with emergency preparedness on some of the neighborhood connectiveness work that they're doing. So I find that inspiring. I know sometimes we can feel a little bit overwhelmed by how vast the work is. Like, oh, we need to make a difference on all of these social determinants. But there's also so many people who care about these issues and so many places that the work can intersect, so we don't have to do it by ourselves. One other thing that I wanted to point out about the great work that's been happening in Johnson County is related to community connectedness, but also leadership of girls and women. And they have been working with local youth on designing a space for girls by girls, a public park area. And so that has actually been approved by the city and it's been funded and it's in its final planning stages. So that's another way that their work is translating into literal community changes that is facilitating better connection and quality of life.
So the last coalition that we're going to go over is Wyandotte County, Kansas. Their efforts are led mainly by MOXA, which is the Metropolitan Organization to Counter Sexual Assault. And they partner a lot with their unified government health department, and they're really integrated into the community health improvement plan. So Wyandotte County, Kansas, the main city in that is Kansas City, Kansas, with a population of around 154,000. And in their needs assessment that they created at the beginning of the grant, 21% of the population was Black and 31% of the population was Hispanic, to give you an idea of some of those demographics for this community. Their two main points for their strategic action plan are social norms and community prevention through environmental design. You've probably heard it as CEPTED. So for the social norms committee, a lot of what they've been doing is working with youth recently to create some social norms campaigns, kind of different smaller projects. They're kind of in some beginning stages of that, working with 3 different youth-based community organizations. So they're working with Young Women on the Move, Thrive, which is like an after-school program, I believe, and then PAL, which is Police athletic. Trying to give those acronyms, but I know sometimes they get jumbled. And then for the crime prevention through environmental design subcommittee, they have some partnerships that are with organizations such as neighborhood organizations, as well as Bike Walk KC. And so that's always like one that we like to share, because with creating safe environments for neighborhoods, the Sexual Violence Coalition wants the sidewalks to be safe to prevent violence. Bike Walk KC wants the sidewalks to be safe so that people are able to walk more and bike more throughout their community, and be able to be active. With their SEPTED approaches, they also use a community by design toolkit. So they go out to neighborhoods and meet with a representative for a neighborhood, and they'll do a walk audit with them where they take their community design by design packet, and it has a list of different crime prevention through environmental design, different frameworks and things to look for, like, is there good lighting in this area? Are any trees blocking the lighting? Are there any areas where it might be easy to hide? Could we light that up? And so they have those questions to help the neighborhood representative go through their neighborhood and be able to check things off, answer those questions, and they try to empower them then to take that information, think about what changes could be done in the neighborhood, and help with brainstorming for different projects that might make the neighborhood feel safer or more connected.
One thing that I just will share is that it is big work, and there are a lot of free tools and resources that are available, about 7,000 pages actually. That's just in English. It's also translated and culturally adapted for Spanish, and then it's partially available in Arabic and Farsi. But it's things like, how do we do a needs assessment? How do we bring people together to create a plan? How do we advocate? How do we evaluate our efforts? How do we sustain them over time? So it's Creative Commons license. We just hope that the resources can be useful to you. We do have a link from the toolbox to county health rankings and roadmaps. And if you're not familiar with it, they have like a what works for health part of their website where they have some really cool strategies around some of these different things we've been talking about. And they have the level of evidence that is associated with each strategy, and also examples of how they've been implemented. So for example, if you wanted ideas about transportation and what communities have done, that's a really great resource. County Health Rankings and Roadmaps, What Works for Health.
Thank you for attending this session, everyone. Me and Christina have our information up on this last slide. So please reach out if you have any lasting questions. And also, I'll just say, if you had a question that I mentioned before my time, please reach out to me again, and I will get that information to you to get a proper answer.
All right. Thank you all.